Mycoplasma genitalium, Mgen, is a sexually transmitted bacterium that causes infections in the urogenital tract, often presenting similarly to other sexually transmitted infections, but sometimes asymptomatic. It can affect the female reproductive system, including the uterus, fallopian tubes, and ovaries, and is identified through advanced genetic testing. Understanding its presence and impact is crucial for women's health, as awareness and early detection can help prevent complications and support informed healthcare decisions. In women, Mycoplasma genitalium infection may cause cervicitis and is associated with pelvic inflammatory disease, or PID. This can result in pelvic pain, abnormal vaginal bleeding, and potential fertility issues if left untreated. However, some women may not experience symptoms, making the infection difficult to detect. Recognizing these challenges is the first step toward better reproductive health. If left untreated, Mycoplasma genitalium can lead to chronic pelvic pain, which may significantly affect a woman's daily life and well-being. Another serious concern is the increased risk of ectopic pregnancy, a potentially life-threatening condition where a fertilized egg implants outside the uterus. Infection during pregnancy can also result in adverse outcomes, including preterm birth and complications for the newborn. These long-term risks highlight why early diagnosis and prompt treatment are so crucial for protecting reproductive health. By staying informed and seeking timely medical care, women can reduce the risk of serious outcomes and support better health for themselves and future generations. The genitalium lacks a cell wall, making it resistant to antibiotics like penicillins and necessitating alternative treatment regimens. This unique structure means that common antibiotics are often ineffective, requiring healthcare providers to use alternative medications. Understanding these bacterial characteristics is crucial, as resistance to standard treatments can complicate care and increase the risk of persistent infection. Under the microscope, M. genitalium appears as a tiny, flexible bacterium, distinct from many other pathogens. Its resistance to antibiotics is a growing concern, making ongoing research and awareness essential for effective management. Infographics and illustrations help us visualize how this bacterium operates and why it is so challenging to treat. Continued vigilance and adaptation in treatment strategies are necessary to address antibiotic resistance in M. genitalium. Scientists and healthcare professionals are working to stay ahead of these changes, ensuring that patients receive the most effective care possible. The fight against antibiotic-resistant bacteria like M. genitalium is ongoing, requiring both innovation and awareness in the medical community. Diagnosis is typically confirmed through nucleic acid amplification tests, or NABLATs, which detect the bacterium's DNA in urine or genital swab samples. Infographic visuals can help illustrate the process, and DNA imagery highlights the importance of genetic testing. In medical centers, rows of test tubes and laboratory equipment are used to process these samples efficiently and accurately. Colorful infographic elements further explain the steps involved, while digital illustrations of DNA and bacteria emphasize the scientific approach. The use of advanced laboratory technology ensures reliable results, supporting effective diagnosis and treatment planning for patients. Visuals of DNA strands and bacteria reinforce the focus on molecular testing, and the presence of free article highlights the importance of accessible information for women's health. Medical centers with rows of tubes demonstrate the scale and organization of diagnostic efforts, while chemistry laboratory equipment showcases the precision and care involved in every test. Through these advanced diagnostic methods, healthcare providers can accurately identify Mycoplasma genitalium, ensuring timely and effective care for women. Treatment can be challenging due to increasing resistance to macrolides, such as azithromycin and fluoroquinolones, like moxifloxacin. This means healthcare providers must carefully select antibiotics and closely monitor treatment effectiveness. In some cases, alternative therapies may be needed, and ongoing research is essential to address emerging resistance. Open communication with your healthcare provider and regular follow-up are important to ensure the best possible outcome. Given its asymptomatic nature in many individuals and potential for chronic infection, Mycoplasma genitalium contributes significantly to the burden of reproductive health issues. This highlights the need for increased awareness, regular testing, and targeted therapy to manage and prevent long-term complications. Understanding its impact is crucial, as many may not realize they are affected. By staying informed and proactive, women can protect their reproductive health and reduce the risk of serious outcomes. Early detection and intervention are key. If you experience symptoms or have concerns, consult your healthcare provider for appropriate testing and guidance. Remember, reproductive health is an essential part of overall well-being, and taking action today can help prevent complications in the future. Empower yourself with knowledge and encourage others to do the same. Together, we can raise awareness and support better health outcomes for all women. Stay informed, get tested, and seek treatment when needed. Your health matters. Learn more about this and other women's health topics in the Informed Woman magazine. Subscribe today for expert healthcare insights written specifically for women. Your health matters. Stay informed, get tested, seek treatment.